Well, today the globe marks World Alzheimer's Day. It's an international campaign aimed at raising awareness and challenging the common stigma around Alzheimer-related dementia. Alzheimer's is a progressive disease that impairs memory and other mental functions. It's the most common form of dementia that generalizes memory loss and loss of other essential cognitive abilities that are indeed serious enough to interfere with an individual's daily life. Well, to chat some more, we are joined via Skype by Petra Du Toit. She's the Executive Director of Alzheimers South Africa. Good afternoon, Petra, and thank you so much for your time on the SABC News Desk.
Good afternoon. It's a privilege to be here.
Petra, we've got some worrying stats in this week with the Department of Health saying that every 68 seconds someone develops Alzheimer's disease. It starts to sound like it's a kind of disease that catches us off guard. Tell us what makes it so deadly at this point.
The problem with Alzheimer's and other forms of dementia is that there's no cure for it. So to correct that stats, every 3 seconds, someone in the world develops a form of dementia. So it's frightening, and people aren't aware of that. So that's why this day was put into place, that people can focus on the devastating aspects of this disease, and that we can start to prepare ourselves for the future and to take care of people living with dementia.
Petra, how has our ability to diagnose this disease improved in the past 10 or 20 years? Because from what we understand, we can now today be more precise, not only on the clinical side, but also on the biomarker side, where we have very sophisticated blood tests, imaging tests, etc.
Yes, I'm aware of lots of research that's been done all over the world, and thanks to that, it is easier to diagnose Alzheimer's or other forms of dementia at the moment. Although it stays a challenge, it's still a challenge, to really diagnose it. But my best advice is always that a person get referred to a neurologist, because this is a disease of the brain, and the brain is very complicated. So yes, I think to your GP and then to your neurologist, to just make sure that you get the right diagnosis and to be able to plan forward, for the way onwards.
Are people in South Africa actually talking more about Alzheimer's disease now, Petra, without levels of awkwardness and discomfort than in previous years? I just want to garner your thoughts on that.
I don't think so. I think it's still a no-no in most societies. People are not talking very freely about it. So that is where an organization like Alzheimers South Africa comes in, that we try to reach out to communities, to talk to people, to explain what it is, that it is a disease of the brain, and that it's actually a disease and people must get help for it. So no, people are still shying away, to talk about it.
We know quite a bit about the disease at this point, Petra, but how is it that it's still not treatable at this juncture?
That is a very difficult question, and I think we must put that to our medical colleagues. They just still didn't succeed in finding a cure for it. So I think it's because the brain is so very complicated. They are not very sure what exactly is, and it's difficult to treat it therefore. So we hope and pray that in the soon future there will be some breakthrough in this regard.
When one is suffering from Alzheimer's disease, how would it manifest in an individual's daily life or their daily operations, Petra?
As the disease progresses, it will obviously become more, have a bigger impact on a person's daily life. But, things like to remember names, to remember faces, to make decisions, to do the right actions, for instance, to dress yourself. It impacts that because a person doesn't know what to put on first. So yeah, in your actual daily routines, it impacts on that. In the beginning, not so much. Then you will maybe start to just forget, a name or whatever. But as the disease progresses, it becomes increasingly difficult, and you will, need more and more assistance with your daily living.
From what we understand globally, there are now more than 50 million people who have dementia. Now, by 2050, about 90 million of the 131 million people expected to have dementia will live in low and middle income countries, and 7.62 million of these will be in sub-Saharan Africa. Why do you think, Petra, are we not seeing a more robust global response? I mean, the response so far has been very slow, with so much of underdiagnosis and poor treatment.
Yes, I fully agree with that. Only 1 in 10 people, in other words, 10% of people living in low and middle income countries get a diagnosis. So it's really, a very devastating statistics. What I can tell you is that South Africa is included now in a global research project called STRIDE. And we are one of 7 low and middle income countries that are involved in this research that was started by the London School of Economics. And from this, I presume there will be bigger awareness. We will get more accurate statistics for South Africa and for low and middle income countries. In our situation in South Africa, I think diseases like cancer and HIV and AIDS are much more prominent and receive more attention, although dementia is the 5th leading cause of death globally. So we really need to focus on this. I mean, it's time, and we need to do that, and we must get all partners, all role players, government, NGOs and other stakeholders must take hands now to address this global disease.
Thank you, Petra. That's Petra Du Toit joining us via Skype there. She's Executive Director of Alzheimer's South Africa.